Retired teachers once again are concerned over actions by the state. This time it is over a recent announcement about health insurance. I want to share my perspectives as your IRTA president to prevent conjecture. It's important to note that IRTA, IFT, IEA, and the other members on that Teachers Retirement Insurance Program Advisory Committee are endeavoring to cooperate on providing news to members. As a matter of fact, the initial email to members of IRTA and IEA are the same because the two agreed that would be helpful. Because the TRIP Advisory Committee had not met in years, I was personally fed up, and I wrote 2 registered letters this summer to both the governor and the CMS director decrying the communication problems that not holding quarterly meetings created, and urging the state to see that the meetings resumed quarterly. That prodding seems to have worked, but we will see over time. It is very important for retirees to understand that the committee is advisory. It is advisory. Many falsely believe that TRS or the advocacy groups control the insurance provisions. IRTA has been monitoring this below-the-radar law enacted this year that called for the state to seek bids on a Medicare Advantage program. A Medicare Advantage program combines Medicare with a supplemental insurance policy. The initial view was that this new law would be aimed at state employees as a pilot program, not yet at those retirees in TRIP. But that has changed. The state simply wants to save more money. From the perspective of legislative leaders, this new direction does not make sense from a strategic point of view. Previously, they wanted to change our cost of living adjustment for access to health insurance. Now they're going in a different direction? At the recent TRIP committee meeting, when the new Medicare Advantage plan was mentioned by CMS, there were no significant details. CMS will release those later, even though they must know some of the parameters because of the bid solicitation. But given the changes this year in copay and deductibles, such as with Cigna, that confused retirees and prompted many calls to CMS, it's not surprising that CMS wants to have their act together. Those who attended the TRIP Advisory Committee have learned that around October 1, CMS will announce a new Illinois Medicare Advantage plan. CMS plans to hold informational meetings around the state then. From mid-October through the end of November, Medicare primary participants in TRIP and other state insurance programs would have to decide whether to go it alone in getting supplementary insurance or to sign up with the new state plan. I agree with those who believe that the decision period for the new Illinois Medicare Advantage plan should be longer. Even if CMS holds meetings around the state after October 1, insurance can be confusing, and changes can frighten retirees. I'm sure all the affected groups would ask for more time if it's possible, but it appears the state wants to sign up completed by November 30th in order to process all those who have signed up and have the insurance ready to roll out on January 1, 2014. It appears that only those who are now Medicare Primary will have to choose. I'll say that again. It appears that only those who are now Medicare Primary will have to choose. They would not be eligible for the current TRIP policy. It appears that the non-Medicare primary group, those not eligible for Medicare and those under 65, will not be affected yet by the new program. IRTA has been proactive in planning for this. This summer, Your IRTA Executive Board met with insurance consultants to review our options. One of those options is researching alternative insurance plans for our members. We're looking at Type F supplemental insurance, which provides the widest coverage while avoiding copays. We are also looking at group policies because they can shield participants from age-related cost increases. And we are also looking at drug supplemental policies. My advice is to avoid panicky decisions. Wait to see what news surfaces around October 1. Then watch for IRTA bulletins and meetings. It is not prudent to jump right now into a new health insurance program without knowing the facts. Retirees can take some comfort in knowing that their organizations are monitoring and sharing what little information they have with their members. But they cannot share information they do not yet have. And it is not smart for us to share or ask for conjecture. Tell any non-member friends that their best action right now is to join the state IRTA so they are ready to receive information and take advantage of any possible IRTA group plan. I hope this information will help you answer questions and concerns from retired teachers. Thank you for your steady leadership. I am Gary Elmen, President of IRTA.